Okay. So thank you for letting me record this session for educational purposes and for marketing purposes. I appreciate that. If you can go ahead and just give a brief history about your injury and why you're seeking some help for your wrist.
Well, on May 15th, I fell off of my skateboard
Okay.
and I caught my weight with my right hand. So I kind of slipped and fell behind and sort of, I can't remember if it was bent like this or like this, but it was kind of caught my weight against however it was bent.
Okay.
So it was so painful. I thought I had broken it, although nothing looked like it was misaligned, but it was like painful and throbbing and kind of like spasming a little bit.
Do you have any pain with the wrist sleeping at night, or does it wake you up at night?
No, none whatsoever.
Okay, excellent. And you're not, pretty much at this point, you're not wearing the brace at all.
No, I haven't put it on since I took it off about a week ago.
Okay, good. Well, then that's good. And you've not had any increased pain. That's a good sign. So let's go ahead and I want you to bring both hands up. So I'm going to kind of look a little bit more into what the hand looks like, what the wrist looks like. And I want to start with the fingers. So if you can just kind of start by curling the fingers if you're able to. And I'm just kind of comparing both sides just to see if there's any kind of deficit. So if you can just kind of open and close and go ahead and go to each finger or each finger to the thumb. So if you can go to index, to middle, to ring, and to small. Good. Any pain or issues or pulling or anything like that down the arm when you do that?
No, the digits actually have been pretty like unaffected, I would say.
Okay, excellent. Then what about the thumb? Bring the thumb all the way across your palm if you can. Maybe just a little stiffness with that one.
Yeah, that one I feel like kind of in there
Okay,
a little.
okay.
Like it feels like I've stretched it. I'm
Stretch.
stretching it.
So now go ahead and just relax that. And I want to specifically look at your wrist motion. And I'm going to actually measure it with my goniometer. So this is my little measuring tool. So I can get a better idea as far as what your limitations are with your wrist range of motion. And then I'll look at your left side too, just to see what maybe your normal is and what the goal would be to get back to.
Is the lighting okay, by the way?
Yes. Yep. It's perfectly fine. I can see it good. So go ahead and bring your right hand up like this for me if you can. Good. And then what you can do is bring that wrist back as far as you can go. So you just go back to, what you can do, what's comfortable for you.
That feels pretty comfortable.
Okay. So what I'm going to do is I'm going to go ahead and measure you. Okay. And right there where you're at is perfect. Okay. So this is going to be kind of out of the line of sight here. So you have about 45 degrees of extension. So you can rest that. And then let's see what you have on the left side. So go ahead and go back. How far back on the left side can you go? Yeah, perfect. Right there is good. And it looks like on that side you have about 65 degrees of extension. And you can just relax the fingers and then bring the wrist forward as far as you can go.
So right there is where in this area it feels tight. It's not painful, but I can kind of like my digits will kind of like move without me controlling it, if that makes sense.
Okay. Okay.
Whereas like if I do that with this one,
They
it just
just
feels
kind
like my
of
hand is
relax.
laying on top. Yeah, they're relaxed, but here it's kind of like it feels like they kind of move on their own. I don't know how to describe it.
Okay. Well, we can look at that a little more. Go ahead and hold that there. Now, the other thing too is if you hold that, do you get any kind of numbness or tingling in the fingers?
Uh,
55.
mm, Not really. It's mostly just a little bit of discomfort right in the like literally right here.
Okay. But that motion looks very good. That looks pretty much back to normal. So since your wrist extension is a little bit less than your wrist extension is a little less on the right than it is on the left. A very simple stretch to do to get that back is to do what's called a prayer stretch. So you place both hands together. So go ahead and do that one together. So palms together, fingers together. And what you do is you slowly slide your hand down. You can do this on a table if you wanted to, or you could do it up like this. But you slowly come down, elbows kind of, stick out to the side. And you just basically go down as far as you can go without, too much pain. You don't want to push that too much. I usually tell people to stick around like a 2 or a 3 pain level.
Okay, 2 or 3.
Yeah. 10 meaning you would go to the emergency room. I would not want you to be that high. So let's try a couple of those. Okay, so coming up and then slowly sliding back down. Right.
Okay.
So let's see. Come up here and let's see if you have a little more wrist extension.
I feel I can push it more a little bit. Push it more back.
And that is, I've got like 55. Yeah, and you had 45.
Nice.
Yeah.
You're a genius. You were right though. You said about 5 to 10 more degrees, huh? That just after one stretch.
Yeah, and you did it a couple times and you held it, and you felt kind of like it release a little bit. But you got to think too, you haven't been really stretching it. You've been just doing more active and using it, which is good. But ultimately, to get that last little bit, you need to stretch it out. So then the opposite then, for you to get more flexion, is you could do that one a couple of different ways as well. You can prop your elbow up on your table and you just bring that wrist down as far as you can go, kind of like the measurement that we took. And then you take your other hand and you just apply a little overpressure.
Ooh, yeah, this one is a little more discomforting. I don't know if it's because it's tighter.
Could be.
But I can feel it like it feels like the last stretch, but it's like a little less comfortable of a release.
Okay. Yeah. And where is it on this side or is it on the back?
It's on the back now.
Okay. Yeah. So you could be.
But it feels good.
So I would just, stretch it a little bit, then relax it if you need to, because coming out of that sometimes can be a little sore.
Yeah. Ooh, it's hard to tell how much I should. It's a very light weight that I want to put on, right?
Yes, correct. Yeah. I mean, you
Okay.
want to put more than just fingertip pressure, but yeah, you want to apply as much pressure really as you can tolerate.
I was gonna ask too about getting back onto my instrument. My plan was to wait and maybe do like these exercises you've given me for about a week and then try to kind of gradually build the amount of time that I'm able to play.
Yeah.
Do you think that it's part of it's sort of a similar concept to just using it actively? Like it will just get better with more kind of gradual usage?
Yeah. And you're talking about playing drums, right? Is that
Yes.
the only instrument?
I play drums, piano, bass, and guitar, but with piano is less. I've played a little bit actually. It's because your wrists are supposed to be more flat with ideal playing
Right.
of piano, but drums can potentially use a lot of wrist motion.
Right. I would even if you can, even at this point, so after you've done some of your stretches, so doing, this stretch and doing this stretch, I would even take your sticks and even doing a little bit of that side to side motion. So, you felt a little bit of the side to side, right? When you were kind of
Yes, yeah.
moving. So what if you took your sticks and incorporated this radial deviation, ulnar deviation? So you're doing basically more isolated type movements. You're getting this back, you're getting this back, you're getting this back, you're getting this back. I would even think you could even start to do a little bit of your gradual now because you're not having pain. You've got really good motion. So I would think even if you maybe tried to just see how it feels with the impact, probably, that might maybe get you a little bit more, I'm thinking. When is your goal to get back to full-time, instruction with students?
Well, my goal for full-time like playing is in July. And to me, what that means is being able to play a 3-hour gig comfortably. So
Okay.
I think that's sort of, because I've mentioned to you that I've had some kind of like tennis elbow kinds of problems. And so anytime stuff like that happens, I try to really be careful about not playing for multiple hours right away, trying to build it up as gradually as I can.
Good, good. That's the smart way to do it. Definitely. And
But you think it's good to kind of just sort of test it?
yes, yeah, I do.
Okay.
Because it'll give you a good gauge, like, because you may be surprised. You may find it feels pretty good. And so then if it does, you could start your slow, you could start your schedule of slowly introducing it now at this point. If you wait a week or so, I don't see how, what the difference would be because your pain is low, you've got good motion, you're already seeing improvements just with doing a little stretching. So I think you make it a part of your exercise program at this point. And then if you have a ball or
Okay.
something that you can work on getting kind of some of that grip strength back too. Do you have a ball or a stress ball that you can squeeze? Let's see here. If you have like a squishy ball or something like that, So I made this one. This is a see how I can kind of squeeze. So this is
Oh
actually
yeah.
a balloon and flower.
Oh, okay.
So I made my own little, DIY gripper because that, or, if you really wanted to work on getting the grip strength back, I have stuff called putty. So you can order this online and you can actually work on getting kind of like that grip strength back in the hand as well, which I can always send you a link for that. All right. Well, so just to recap everything, 5 to 10 reps, 2 to 3 times a day of the prayer stretch, of the wrist stretch, taking your drumstick and back and forth, and then the side to side. Okay. So those 4 for the wrist. And then if you happen to find like, a ball or something that you can kind of slowly start incorporating a little bit of grip, that wouldn't be a bad idea at this point either, to maybe just a little bit of that. Okay.
Okay, yes. Yeah, perfect. That's perfect. Thank you.
Okay, great. Well, let's go ahead and connect again maybe in a week or two if you feel like things are progressing really well and you want to kind of upgrade, and then we could start a little more specific, maybe wrist exercises like for strengthening maybe at that point.